بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل، آمين يا رب العالمين. My topic today is about Enchondroma. Enchondroma is a relatively common intramedullary cartilage neoplasm with benign imaging features. Enchondroma most commonly seen incidental finding, most significant in that should not be confused with more aggressive lesions. As a rule, enchondroma should be asymptomatic. However, lesions of the hands and feet may be present with pain from pathological fracture or impending fracture. Malignant transformation into low-grade chondrosarcoma is rare in simple enchondroma, simple solitary enchondroma, and may be present with pain. Solitary enchondroma of the hand, it is involving the proximal phalanges in 40 to 50% and involving the metacarpals in about 30% and involving the middle phalanges in about 20 to 30%. Distal phalanges involving in about 5 to 15% and the carpal bones involve about less than 2%. Here we see an enchondroma involving the proximal phalanges of the proximal phalanx of the middle finger and represented as narrow zone of transition, sharply defined lesion with chondroid matrix. Here another patient with sharply demarcated lesion involving the proximal phalanx of the index finger with chondroid matrix in this BA view. Possible another one is here. The the same patient in another view, the enchondroma are seen in proximal phalanx. Here, patient with enchondroma with pathological fracture, as we see here, and pathological fractures are seen and commonly treated with curettage and bone grafting with follow-up X-rays to monitor the healing. If there is sometimes recurrence reported after in about 2 to 15%, this suggests malignancy. If malignant transformation is suspected, with which occurs less is obtained operatively. Recurrence, it is reported in about 2 to 15%. And malignant transformation is less than 5% of cases, and then the treatment should be aggressive. Here is another enchondroma involving the upper tibia, as we see with the chondroid matrix. Here the MRI with enchondroma involving the distal femur, as we see in T1 and T2. In T1 it is low signal intensity, and in T2 high signal intensity with low signal intensity due to calcification. As we see here in T2 fat set, there is no edematous changes or bone marrow or soft tissue edema seen. Here, patient with multiple enchondromatosis, we call it Ollier disease, and it is involving, as we see here, multiple enchondromas involving the metacarpal and multiple phalanges, so both hands, and this is Ollier disease, multiple enchondromatosis. It is a sporadic inheritance with no genetic predisposition. Skeletal dysplasia with failure of normal enchondral ossification. Enchondromas through the metaphysis and diaphysis of long bones also involved. And involved bones are dysplastic with shortening and bowing. And the risk of malignancy in Ollier disease is less than 30%. Here another patient with multiple enchondromatosis, as we see here, there, and there. Here is another patient with multiple enchondromatosis involving the lower limbs, in this example the femur and the tibia, and we see the bone is dysplastic with bowing and deformity. Here is another patient with multiple enchondromatosis, as we see, involving the hand with multiple enchondromas, and the MRI, as we see, it is high signal intensity of enchondromas. Here, this is another example with multiple enchondromas associated with soft tissue swelling and fibrillous calcification, and we call this syndrome is Maffucci syndrome, and it is a sporadic inheritance with no genetic predisposition. We see multiple enchondromas with soft tissue angiomas, and this syndrome, their cause markedly expand the bone, and angiomas are seen small, rounded, calcific fibrillous. And the risk of malignancy of malignant transformation reaching up to 100%. And also increased risk of visual malignancy like astrocytoma and GI malignancy. Here another patient with Maffucci syndrome, as we see multiple enchondromas with soft tissue masses and with angiomas. Thank you for listening, and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.